Hey guys, many of you now have this device called a Denneroll, very similar to a orthotic in your shoe to help increase your arch of your foot. This helps induce that normal arch or curve in the back of the neck, taking off pressure off those discs, the spinal cord, and the soft tissues in the back of the neck. Recommended use for this is upwards of 20 minutes, and that's where the research was done on it. So if you were doing this, you should be using this every single day. I like to do it at night, and so I find it to be most effective when I do my exercises on the edge of my bed at night, my wobble exercises, and then I lay on the roll, the Denneroll, for nearly 20 minutes. As far as placement goes, a couple different placements, but 90+% of the time, we're going to want the apex, the top of this roll, to be right near that little bone that kind of sticks out at the bottom of the neck, where that hump starts. You're going to put it right there, and the head's just going to traction right on over it. So I'm going to have Shoshana demonstrate here. So bed is sufficient, although a flat hard surface would work even better. Again, this is going to go right there at the tip. Head's going to traction over it. Good. And then we want to make sure that the shoulders are relaxed and that there's a good space between chin and the chest. Really important that we're increasing and inducing that normal curve. Start with the first 2 to 5 minutes, and then we'll increase up to 20 minutes. Many patients even report lasting much longer than that, but I recommend kind of building yourself up to that. Shoshana's going to show us the proper way of getting up from the Denneroll. So notice how she gets onto her side and then rolls up. It doesn't just jerk her head straight up. That can actually kind of lose some of the effect from using the Denneroll. Hope this helps. Again, every single day.